lot of different families or people with chronic pain, but also a lot of athletes as well. Mixed martial artists, and as far as there's a therapy called prolotherapy that's out there that I don't know how long it's actually been about. When I was even in school, there was one of my mentors actually talked about it, and it was still kind of new at that time. Can you kind of explain and
Sure.
Just give us a background of what that's all about?
Sure.
Yeah.
Well, prolotherapy is it's an injection therapy.
Okay.
It's designed to stimulate the body to heal connective tissues such as ligaments and tendons, which that's obviously joint related.
Mm-hmm.
And George Hackett was a doctor in the United States, and I think probably about 1953 actually, prolotherapy was. He introduced it as prolotherapy to the world.
Wow.
Of course,
1953.
1953. So it's been around, and it was a very simple idea, but the idea was radical. It was that,
Was he a naturopath?
No, he was a medical doctor.
Oh.
Yeah, he was a medical doctor. But his idea was that, by stimulating a stronger inflammation at the site of injury,
right,
you can actually allow the body to repair ligaments and tendons.
Really?
Yeah.
Wow.
So, to inflame an injury was something that was very hard for people to really grasp.
Oh yeah. I don't know. I mean, so like, yeah. Okay, keep going.
Yeah. So, if there's one part of your structure, your physical structure, that's going to have a problem healing from injury, it's usually the joints. As time goes on, you see people in your practice and they're coming because of their back, or their knee,
right,
or their shoulder, or their elbow.
Right.
Even if you broke a bone, you give it 4 to 6 weeks and it'll heal. You strain a muscle, it'll heal.
Yeah.
But, you tear your rotator cuff. That's usually surgery, right? So the idea is that, ligaments and tendons by nature, they don't have very good blood flow. So that lack of good blood flow means that when the body is injured in those areas, it cannot supply enough of what raw materials and growth factors it needs to actually stimulate repair of the injury. So if blood flow is what brings all of those growth factors and repair factors to an area, why don't we get more blood flow to those areas?
Right.
Okay. That's called inflammation. Okay.
Yeah.
But
because like when you injure an area, then
what happens when you injure an area, right?
Yeah.
You injure an area, it turns red. It might swell. It might even, it's obviously going to be painful.
Right.
Right.
But it's like the body's natural mechanism to actually bring about the healing.
Yeah, it's built in.
Interesting.
Right?
Yeah.
So, but to use another analogy, it's like if I said to you, Rich, help me build this fire, help me build this campfire, and I give you a big tree stump and one little match, right? You have the right materials,
right?
But the reaction that you're gonna be able to actually initiate is not strong enough. You're creating smoke, essentially.
Right.
It's annoying.
Right. From the little match.
Yeah, exactly.
Right.
So what is chronic pain? It's annoying.
Right.
It's not healing. Okay? In fact, if you look at a joint that's chronically injured, it's past the stage where the body's actually laying down new tissue and repairing. It's now in a stage where there are no cells that are producing new tissue. You have a lot of fluid and you have a lot of pain. It's actually a degenerative inflammation.
It's like an old stump.
Yeah.
In a way.
Yeah.
Right.
And so what we essentially want to recreate with prolotherapy is we want to recreate acute injury.
Mm-hmm.
Okay, but specific, you know, right where we need to generate new tissue.
Mm-hmm.
And that's why, as much as I would like there to be a kinder, more gentler way to do it, it's injection therapy.
Okay.
Yeah.
Okay.
And we put the needle where the connective tissue is, and we can stimulate the body to, you know, initiate its built-in healing response.
Okay.
So, you know, in Dr. Hackett's day, his main proliferant, or the main substance that actually initiated this proliferation of new tissue, and hence the name prolotherapy,
mm-hmm.
was dextrose, which,
okay.
as you and I know, it's sugar hormone.
Yeah, sugar hormone.
Yeah. So
sugar hormone.
Yeah. So as a therapist or as a physician,
mm-hmm.
I mean, what better medicinal substance than something that is safe,
mm-hmm.
but effective?
Yeah.
You know, that's the ideal, right? No side effects, right?
Yeah, yeah.
So of course, since that time, though, prolotherapy has evolved, and you know, new ideas come up, and now there are many other proliferants, including, you know, even your own plasma from your own blood.
Mm-hmm.
You know, and we now, in my practice, we do treatments with platelet-rich plasma that are so much more effective than even, you know, the original dextrose prolotherapy.
Oh yeah. One of the things that kind of just comes off the top of my head is, well, you're recreating injury, you're
mm-hmm.
recreating inflammation. What does the patient actually experience
mm-hmm.
during, or maybe even after? I mean, I'm kind of thinking, well, you're re-injuring it. Is it going to hurt again? Is it going to be, you know, am I going to be strained for another 3 to 4 weeks or something?
You know, it's very counterintuitive when you've been in pain for weeks or months or maybe years.
Yeah.
For the doctor to say, okay, we're going to do this treatment, and it's really going to hurt afterwards, right?
Sign me up.
Yeah, but
6 to 8 weeks or whatever.
But I mean, hey, we're recreating acute injuries, so yes, we want inflammation.
Right.
So but it's specific. It's very focused.
Mm-hmm.
Okay. So it's not a match. It's a blowtorch.
Okay.
Essentially.
Okay. Wow.
So what you want to typically have in mind when you're considering a treatment like this is that, yes, for a period of maybe 24 to 72 hours,
uh-huh.
the inflammation is going to be intensified.
Yeah.
But obviously, you can't take your Advil or your right? You can't take
be fighting against the process.
Exactly, because and this really boils down to how you want to treat a problem. There's
right.
no right or wrong. But if I explain to you that, you know, the body can apply its physiology to heal, but the physiological process to heal involves inflaming,
mm-hmm.
and you keep taking anti-inflammatories,
right?
How can you expect your body to ever heal that injury?
Right.
Right? So then that puts a new sort of wrinkle into people's ideas of, how do I treat my chronic pain then?
Mm-hmm.
Should I actually be continuing to take these anti-inflammatories?
It kind of makes me think about the whole analogy, or the whole saying that I heard in chiropractic school a long time ago, which is, if you keep doing the same thing that you've been doing, how can you expect to get, you know, a different result?
Yeah.
I mean, that's insanity. Is basically what it is. It's like, you know, people will go years and years in a sense of chronic pain because that's how they've learned to accept it. And yet, maybe a newer approach, even though it may cause a temporary, you know, change,
reduction of symptoms. Yeah.
But temporary increase in symptoms.
Oh, yeah, temporary increase.
Right?
I see, yeah.
If it actually helped in the end, wouldn't that be worth it? Right? So like 24 to 72 hours, you start to...
You're going to have an increased inflammation.
Which is probably a good thing.
Which is probably...
Which is
part of the process towards a good thing.
Right.
Yeah, and then it will die down. And then the funny thing is, the pain usually goes back to the way it was feeling before. But what are you going to experience? First, you'll probably experience a little bit of increased range of motion. Okay?
That's pretty huge for people.
Yeah, but the pain's not going to dramatically improve just yet. Then the subsequent treatments, you're going to have that increased range of motion, and now you're going to experience a little bit more strength, but you'll still have the pain. And with increased treatment, you're going to have that increased range of motion, you're going to have that increased strength, and then you're going to start getting a reduction in pain. Because remember, we're talking about chronic injury.
Right. And that, I mean, how long does the process take?
You know,
what can they expect?
There's a lot of different factors. You know, I think the most significant factor is how significant is the injury and how chronic is it. You know? Because as you know, it's not just the original injury, but then you have compensation.
Right.
Right.
Totally.
Yeah.
And I mean, yes, I can understand that a lot.
So in chronic pain, you have to identify what is really generating the pain.
Yeah.
Right? The pain generators. And so a lot of our work before we can even treat the root cause is we have to peel away a lot of the compensation first. A lot of the surrounding muscle tension or you know, the alignment issues. Right? And so even though, I don't know, to take a common example, even though it's a low back injury, the person that I'm dealing with may have spasm musculature.
Yeah.
The person that I'm dealing with may have very poor alignment because they're guarding that area to protect it.
Right.
And so, you know, that's also why I say I need a team. I need chiropractors. I need physiotherapists. I need, you know, acupuncturists. Because you need the right tool for the job.
Right.
If I try to build the whole house with just a hammer, it's not going to look good, and it's not really going to happen.
Yeah.
At the right time, I need the screwdriver. I need the saw. I need the, you know, to use that analogy.
It's not like you would hire a plumber to build your whole house,
no,
right?
No.
My goal with these different types of segments that we do is to help introduce you to people that can help, and also to help you identify what's actually going wrong in your health. Sometimes you'll be able to identify that through your own inquiry, but other times it's like you need some help because you haven't been trained to really look at it through a certain set of eyes. And you know, I'm so glad to actually have Dr. Chan here to be one of those, you know, people to mentor people, you know, to ask them those types of questions that they don't ask themselves.
Sure, yeah.
And to identify where the blockage actually is through the set of eyes of naturopathic medicine. This has been so great.
Yeah,
you know, I think it's been a really good interview, and I'm sure that you guys probably have tons of questions in terms of you know, things that you would like to comment about, questions that you have. How do people, you know, your practice is in Burnaby?
Yeah, I practice at Performax Health Group Clinic in Burnaby, BC here.
Okay. And I'm sure there's a website, but you know, how can they actually reach you? What's the best way?
The best way to find out more about what I do is my website, which is www.drvictorchan.com.
Okay.
And if you want to email, it's simply info@drvictorchan.com.
Okay, great. Well, Victor, I really appreciate, like I said, the conversations that we always have together. You know, if there's other things that we might be able to talk about, to be able to present to you guys, like I said, please let us know. But I'd like to thank you for your time, and we'll get a chance to talk soon.
Great.
All right.